Welcome to the Village Boy podcast. This is your host, Trez, and today we're having the conversation about health care insurance. Is healthcare insurance a scam? Is what has been asked across the board. Is health insurance in America a scam? Today we're going to unpack the costs, a racial component of healthcare. You will be surprised, but there, as with America, there's always that little aspect of racial implication and the in-network game. Let's unpack this, shall we? I'll start the story with a little something that happened to me about 30 years ago. When I was in my prime playing soccer, I thought I was going to be the next Cristiano Ronaldo, the next Lionel Messi. I was taking up on players, dribbling the ball, going around the place. And I got tackled so hard, I fell to the ground. And I think I injured my back. After the game, I couldn't play because there was this stab on my back that was just like a knife was stabbing me. But I was 6 hours from home, so I had to drive. I was playing for at a tournament 6 hours from home. So I managed to drive back home. Got home. My girlfriend at the time took me to the hospital. At the hospital, she left me at the ER. I was at the ER for 3 hours, practically very empty. It was about 4 or 5 people at the ER at the time. It's not a crowded ER. And it took 3 hours to get to see me. Maybe they would be easy with ambulances coming in. I don't know, but it was not a full house ER sitting out there waiting to be seen. Eventually I saw the triage nurse. I explained to her my pain, my ordeal. And I was asked to come in. I was put in a room and I was supposed to see somebody. Eventually, a gentleman came dressed in one of those white coats. I thought it was a doctor at the time. It was not even a doctor nor a nurse practitioner. It was a physician assistant. At the time, I did not know. But eventually, during our conversations, I found out that he was just it's not just, it's hard to become a physician assistant, but it was a physician assistant. I did not see a doctor. And so he told me that, I had strained whatever muscle was on my back. And he put me on this medication, naproxen and Flexeril. I went to Walmart. I bought both of this medication, and I had insurance at the time. I went to Walmart and I bought both of these medications for $8, $4 each. I used my insurance card, paid for it, and I had given my insurance at the hospital. So when I went to Walmart, I gave my insurance. The insurance cost was $4 a piece for Flexeril. I think it was 5 milligrams, and naproxen, I can't remember so long a time, and 30 years is a made up issue. It's not 30 years. Naproxen was 200 milligrams, I think. I think some kind of pain medication. So I got back home. I took Flexeril and I took the naproxen, but the Flexeril did knock me out. So I have a very low tolerance. I took it twice and I figured out I couldn't function. And this was 5 milligrams of Flexeril. And I was like, you know what? I know it's a muscle relaxant, but I don't like the feeling of getting knocked out. I can't function when I take it. So I stopped taking that BS medication. Naproxen, I kept taking it for the pain, and I was pretty young, so I think my body healed itself. I'm hoping it did heal itself. I'm much older now, but I wasn't gonna take Flexeril. That would be putting me out. I can't function. I can't drive. I can't work. I can't do. Now I was just looking like a zombie. So I was like, yeah, now this medication is not for me. So to this date, I'm scared of Flexeril, and I see people take 10 milligrams every 8 hours like candy, but I'm not judging. So let's get back. So 2 weeks later, I get a bill from the hospital for about $3,000. And I look at the $3,000 and then I'm like, wait a damn minute. $3,000 for what? Nobody touched me. I wasn't on any IV. I wasn't on anything. Nobody laid their hands on me. I spoke to somebody. I said, hey, I fell, playing soccer and my back hurts. Nobody touched me. They didn't physically put their hands on me to assess. Whatever I said was enough for them to diagnose me and put me on whatever medication. And so from right there, I was like, so what was $3,000 for? So I called the hospital. I called Mercy Hospital in Oklahoma. I called them. I said, listen, first off, I have insurance. My insurance should be paying this bill, $3,000 bill. And they're like, yeah, your insurance has already paid their part of the bill. This is your portion that you need to pay. I'm like, wait a damn minute. How much was the bill? If my insurance has already paid its own fair share, how much was the goddamn bill? And how come I'm left with $3,000? They're like, yeah, you have to take that up with the insurance. It's none of our business. You have to go ahead and take that up with the insurance company. I wasn't ready to pick up that fight with the insurance company. So I said, please go ahead and send me the bill. So they sent me my portion of the bill without the portion that the insurance had paid for. So for example, if the bill was say 20,000 and insurance had paid what is that? 17,000 and I was left with 3,000, or if it was 10,000, the insurance had paid 7. So I didn't see that part of the bill. All I had was doctor's costs, insurance, emergency cost, everything. I mean, there was a rate for the doctor. I didn't even see the doctor. There was a PA, there was a doctor, there was everything that's amounted to $3,000. So I called them back. I'm like, okay, you're charging me $750 for an ER visit. They're like, yeah, that's how much it costs to be at the ER, to come to the ER. $750. I'm like, I waited outside for 3 hours before I was seen. They're like, yeah, we get busy, but once you come in, it costs you $750. And I'm like, okay, if I go to a restaurant, it tells me if you're going to eat the filet mignon, it costs $300. It costs $20. It costs $8. It costs $14. I look at it and I know how much it costs and I know how much I'm willing to pay for it. And I make the decision to pay for it. How am I finding out that the ER cost $750 after my visit to the ER? And I was told, well, if we tell you that it costs $750, nobody is going to come to the ER. People are going to die at home. Rightfully so. Who wants to come and get $8 medications and pay $750? The medications cost me $4 for each, $4 for one and $4, $8 total. And my ER visit alone cost me $750. $750 to go sit for 3 hours in the waiting room, in the triage, in the ER section, and get seen for maybe 15, 20 minutes. And that 15, 20, 30 minutes is $750. A nurse probably did vital signs. That nurse is getting paid $30 an hour to do me vital signs. A PA is getting paid $60 an hour, $45, $50, $60 an hour. They didn't even see me for up to an hour, 30 minutes at most. And the ER visit cost $750. The doctor that supervises that PA, there was a doctor fee in there. There was some recommendations, some taxes. Everything came up to $3,000. I told him that, listen, I'm not going to pay this damn $3,000. I will not pay it. And I don't know how that be. Because I probably never paid. Because I'm like, I cannot have insurance. And they will not tell me. And the insurance, whenever I call the insurance, they will never, they don't, some drag, pulled on, prolonged conversation. But that tells you how corrupt the health insurance system is in America. That I had 100%. I had some of the best insurance you can get. And for a back injury that ended me with naproxen and Flexeril that cost $8, I was left with a hospital bill of $3,000. And that's the beginning segment of this show. And has it gotten worse? Yes. They've created crap like urgent care that I don't know what they do, but it was supposed to fix the ER. But it's again another money play. Everything about healthcare is for profit. There's never the focus on the individual. But let's not get carried away. I found an interesting post that details American healthcare system. Let's take a look at this guy. He is Dutch Rojas. He says the US healthcare system isn't broken. It's an engineered scam, legalized corruption wrapped in non-profit labels, lab coats, billing codes, and suites. Here's the here's the one stat that proves it and why you are broke, sick, and still on hold with your insurer. The US insurance system has 3,006 lobbyists. One system has 3,006. All of Americans don't have this many people advocating for the benefit of Americans. These people are not there fighting for you. This lobbyists, they're fighting for the bottom line. They're fighting for the insurance company, the pharmaceutical companies, the hospitals. These are the people making all the money, not you. You're just a client. You're the one who's supposed to expend your heart and income. Let's dig deep into his threat, right? Let's get into his threat and see what he's talking about. Big pharma, big insurance, and medical devices together they employ 3,006 lobbyists in DC. An average lobbyist make about 250K, maybe 150K. They have 3,006 of these thieves in DC. That's an average. That's 5.6 lobbies per member of Congress. So when a member of Congress sits, there's about five people sitting around him or her petitioning for a device, a medical device company, a pharmaceutical company, or for-profit hospital company. Because hospital for profit should not add hospitals in there. It should be for-profit medical company, which mask as a hospital. They don't care about you. They care about making a profit. Imagine a hospital that is for profit. How are they going to care about you when they have to make their quotas to earn a profit? Right? So, Big Pharma, the worst of the worst, has 1,845 lobbyists, devices, your medical devices, CPAP, wound vacs, and all those guys, wheelchairs, all these device companies have 622. Insurance itself has 539. Total Congress has 535 members. These lobbies aren't visitors. They are embedded. They are plants. They're in there to work against you, but for the interest of their employers. What do? They just don't influence policy, right? These people, these thieves, they write the bills, they fund the campaigns, they bury loopholes 400 pages deep. Whenever I hear about a Congress, they're like 400 pages. Who reads that stuff? We need to have AI be able to read this and then give us a summary. Because Congress folks are not reading, they're just going to pass that bill. So you don't notice until the bill shows up. Like me, I thought I had insurance and I didn't notice until the bill showed up. What did that do for me? It created trauma. I don't trust the ERs anymore. And knowing that the ER is 700, and that's a long time ago. So now ER visits about 2,500 because it's probably increased. I don't know that I can consciously go to the ER anymore. Honest truth be told, because the bill, the shit, I could be like, oh, I have a pain that maybe it's really nothing, but it hurts me. It's something that I can take Tylenol and get rid of it, and I can go to the ER and come back with a $5,000 bill for something that Tylenol could have fixed. And I don't trust urgent care because I know at least 10 people who have gone to the urgent care and they couldn't even diagnose what was wrong with them and they ended up unfortunately passing. I will never advise anybody I love, maybe an enemy. I'll tell my enemy go to the urgent care because I know probably how it's going to end, right? But I'm not going to tell anybody I love to go to an urgent care because I know how it's going to end. And me personally, if I'm conscious, I don't think I would go to the ER because subconsciously I'm going to think the bill, unless I know that I'm going to die either way, then I'm going to go to the ER. But that's how broken I see the ERs. It's a financial magnet, a bankruptcy system. When you go there, as soon as you walk in, it's like when you buy a car and you take it out of the dealership and they say that car has already lost $2,000, $3,000 in value just by driving it off the lot. That's how going into the ER should feel. Once you go into the ER, you've already incurred $2,000, $2,500 of costs without anybody touching you, without you even talking to anybody. Just being in the ER is ka-ching, 2,500. That's the American medical system. Let's continue. I love this page. I'm going to like this guy's page and follow him because he break this down so everybody can understand. The results, insulin cost $300. There was a time where Americans were buying insulin for their pets to use it for themselves. Let me say that again. And I think it's still happening. There was a time when Americans were buying insulin for their pets, but they were going to use it for themselves because the insulin for pets were cheaper than insulin for humans. CT scan costs 2,000. I don't know what year he made this post to say CT scan costs 2,000 or what state he is in. CT scans probably cost $5,000 right now. And they could scan you and come back and, oh, okay, nothing was found. We didn't see anything. That's a $2,000 cost right there to not find anything. Right? I think if it's that expensive to figure out for a CT scan, there has to be a test that is done that should reassure the doctors that when we are going to do a CT scan, we're going to find exactly what it is that we're looking for. That it gives us a measure, say, okay, the CT scan confirm our fears, and this is how we're going to proceed. But you can't do a CT scan and you're guessing if there is or there isn't. Right. And if there is the whatever it is that you were looking for, we didn't find it. And now the patient is stuck with $2,000 of a CT scan. That don't make no sense. So once you're doing a CT scan, you should be at least 90% sure that yes, we're confirming where it is, whatever it is that we're scanning to find, so that the bill for the scan is valid. And all we're doing is treating. I know we don't treat people in America, we just maintain. But at least we know that the $2,000 for the CT scan was valid. It was not, oh, no, you're fine. We didn't find anything. I mean, patients want to hear that. They want to hear that they're fine. Nothing was found. But they have to walk home with a $2,000 scan bill that came back negative. If America can't fix this, America has no business fixing building nuclear bombs. Nuclear bombs and everything. If they can't fix a CT scan that can be affordable, a scan that's going to be a couple of $100. You can't tell me that they have scientists building hydrogen bombs and atomic bombs. Missed priorities. But let's not distract ourselves. ER facilities, 1,200 for just walking in. Like I said, 10 years ago, when I went into that facility, it was $750. Now, just walking into an ER is 1,200. It has probably gone up in some states. And I'm asking folks, why would you take yourself to the ER and walk out with a bill that's 1,200 for a problem that they're going to say we refer you to your primary physician? We gave you Tylenol. We gave you a bag of Ivy because you're dehydrated. The ER bill costs $1,200. How, looking at this ER bill, should anybody who is conscious actually knowingly walk into an ER? I say no. But of course, the fear that something worse may happen if you stay at home is also lingering. So you have to go to the ER because you don't know what's going on. But for $1,200, with the potential that they may not even do anything, you may tell them a series of things and they really don't know much. They're gonna be running random tests, and every test they do is $1,000, $2,000, up to $20,000. And it's a hit or miss system. They're trying, let's try this, let's sample this, let's try this, let's run this. They could do 20 different tests and all come back negative, and you're already at $20,000 and they don't know what's wrong with you. And they send you home and you die. That bill is going to come due. They're going to send it up. When they're doing your estate, when the government is doing your estate and selling out your property, they're going to pay that $20,000. And they didn't find what was wrong with you. They didn't know what killed you. They're not going to take responsibility. Because it's for profit. They don't care about you. It's for profit. Anything that is for profit does not care about you. You are just a number. And there's so many of you. It's a service that you need. Until healthcare is not for profit in America, before America is going to understand the importance of healthcare. Innovation in healthcare is not because they care about you, it's because there is money to be made. If I come up with a product that is going to be profitable, of course I'm going to innovate that product because it is profitable. Right? But for Americans to buy insulin for their pets and use them on themselves, is that what advanced countries do? Congress has socialized medicine. They have free health care for life. Their spouses are covered. Their children are covered. Why can Americans not have the same health care that Congress has? What is the privilege of being born in America? I've always asked this question. What is the privilege of being born in America? When you're born in America, you are billed to your parents immediately. C-section could be upwards of $50,000. Vaginal delivery could be somewhere about $18,000. You are an immediate cost to your family, your parents, your mom and your dad, just being born. But what do you get out of being born in America? What are the advantages? What is it that you can pride yourself like, yes, this is what being born in America reflects? Absolutely nothing. Absolutely nothing. You get nothing for being born an American citizen. You're not born into some kind of prestigious, the richest country in the world. You're not born into some kind of prestigious medical insurance for you. I think every child born in America should have some kind of same kind of insurance that Congress people have until when they are 22 and then they jump out of it. Think about it. Think about how special you would be if a child was born and they were covered to the extent of the way Congress are covered. Doesn't that make that child? Imagine when you're explaining America to somebody. Oh, the child is protected the way our Congress people are protected. That's what it means to be an American child. The privilege that comes with that level of protection. Not the adults, the child, up to when maybe 18 or 21. But you're building stealths, you're building impossible weapons that would do so much harm, but you cannot fathom that a child born in America has the privilege and benefit of being born an American. And what's the weight of saying I'm an American? What's that weight? What is the substance in there that you're an American by birth? How many children are going to run for political office? How many children are going to be president and vice president? That's the only special thing you get for being a birth American. You get to be president or vice president. There's no difference. There's no benefit in being born in America. There's no protection. There's no cover. Everybody gets that same coverage. A visitor visiting America, a permanent resident, although they're trying to do away with permanent residents here right now, another topic for the village boy to address. Naturalized citizens, they're trying to do away with naturalized citizens, except they're coming from white European countries. But what is the benefit of being born in America? What do you get? Is the birth even free? Is it even not even free? Is it affordable that you're saying Americans can go to the hospital and have a child for say $1,000 or $2,000? The government covers the rest. No, it costs upwards of $50,000. $50,000 to get an American citizenship in exchange for what? What's the value of that American citizenship? It's not that I don't think that America is the greatest country in the world, but what is the substantial value of that American citizenship vis-a-vis the debt at the time? At $50,000, what is the substance of that American citizenship? What has America done for you? Giving you an American citizenship, and they can always take it at any time. If you did something stupid, they're telling you that you go fill out a plan, silver, basic, gold. That's what they're telling you. Employer-based insurance, the biggest scam ever. In a country that prioritizes contract work, seasonal work, than anything else. And employers that fire people on the fly. That loyalty that people used to have 30 years on the job, it doesn't exist anymore because a lot of jobs right now are contract jobs, seasonal jobs. And so you're working at a job, the insurance is good, but you hate the job, but the insurance is good. You hate your boss, you and your boss don't get along. Or you and the people that work there don't get along. Or the vision of the company does not even align with you, but the insurance is good. You're going to stay there because the insurance is good. You work for another company, the insurance sucks, but it's an amazing company, but the insurance sucks. This is what Americans are dealing with. This is what Americans are dealing with every day because they have an employer-based insurance system. You can get fired. You can go 3, 4, 5 months without being able to find a job. So in that period where you get fired or where you're transitioning or where your contract comes to an end or the season is over, you're not supposed to get sick. You're not supposed to have a medical emergency where you get to go to the hospital. Why can you not have insurance that does not have anything to do with your job? So I can work where I want to work and not focus if the insurance there is good or bad. Because not every job has the same quality of insurance. Some jobs have good insurance, some jobs have crappy insurance. Some jobs with a lot of people have the ability to negotiate pay because they're bringing in more customers to the insurance companies and they're able to negotiate for cheaper rates. Some companies have 10 employees, 5 employees. They're not good, their rates are going to be higher. How fair is that? How fair is it that you're working for a company that has 100,000 employees and I'm working for a company that has 3 employees? How fair is it that I'm paying more for insurance because we are smaller in number and our ability to pool in the insurance market is not as strong as you who have 100,000, 10,000, 1,000, 550 employees? How fair is it? How's that my problem? How's that fair to me? For me? And profit, money, it's the driving force for everything in America. The greed, the thirst, the desire to make profits is what people think is the innovation. And even those that suffer the most are also opposed to a system that would work for everybody. Let's finish reading what Dutch Rojas had to say. Insurance companies, year in, year out, are making record profits. CEOs making 20 million a year. 20 million a year. And your claims are getting reviewed. A doctor is calling the insurance after double amputations that, well, the patient has no legs. They're going to need a wheelchair, and the insurance company is rejecting to provide the wheelchair. It's going to cost them money to pay for the wheelchair. The doctor did not specify. The lobbyists are looking for a loophole at every turn. Loopholes are the biggest corruption in America. When they talk about corruption everywhere in the world, they don't call it corruption. In America, they call it loopholes, lobbying. That is America's version of corruption. America is some of the most corrupt country anywhere in the world because it has loopholes. Loopholes is what you use to get out of a situation that you shouldn't get out of. So if a police officer pays me and I give him $20 for a speeding ticket and he doesn't write me a speeding ticket, that is a loophole. In another country, they just don't call it a loophole. In America, a loophole does exactly that. Get you out of a speeding ticket by giving a cop $25, $100, allowing them to funnel you. Big Pharma sells the same company. Same company. It's not like that there's so many companies around the world making the same drug. The same company sells a drug in America for $300, sells the same drug, no added taken different components in the drug, same drug, in Canada for $35, in Germany for $25. And Americans think the Canadian healthcare system is the worst on earth. You are paying $300 and a Canadian is paying $35 for the same drug, and you paying $300, believe that their healthcare is worse than yours. This is the height of brainwashing has never seen before. Why is this possible? Because in the US, Medicare is banned from negotiating prices. Lobbies made that law. So Medicare can negotiate prices. And even if American Medicare wanted to negotiate prices, it'd still be 150 because at the end of the day, the government understands that those greedy bastards at the pharmaceutical companies need to make unimaginable profits. But in Canada, they're not driven by profits, so it's $35. Eloquist, a blood thinner, is sold in Canada for $100. In America, it's sold for $600. A blood thinner. That's how much, if you're on any blood thinner, that's how much your insurance is paying for. If you're on Eloquist, it's $600 in America. In Canada, it's $100. A blood thinner thins your blood so that clots don't, kill you. It costs $600. I saw an MS medication. I can't even remember the name. The patient did tell me that that medication was over $25,000, $30,000. I almost had a heart attack. If you probably go to Mexico, or if you go to Canada or Germany, that medication will probably be $1,000, $500. They're going to tell you regulations. They're going to tell you restrictions, bureaucracy. It's BS. It's a system that works the way it was meant to work. He says this isn't a healthcare system. It's a protection racket with a branding department. You're not a patient. You're a revenue stream. It's a saying. They don't heal patients in America because if you heal a patient, you've lost a customer. What was the racial component? Because universal healthcare has been a conversation in America for so many years. But why is it not a possibility? Why do poor folks in America and the majority of America who are white folks oppose universal health care? Why do poor folks oppose universal health care? You'll be amazed. Poor white folks believe that they are paying into a system, poor and middle class white folks. They believe that they're paying into a system that's going to benefit colored people. Because everybody's going to have universal health care. And the understanding in America is that colored people usually don't work or contribute enough into the system. And so there will be undeserving recipients of a universal healthcare system that they did not contribute or work towards. So when you see people oppose to universal healthcare, even those who claim, oh, communism, socialism, so government is going to take over your healthcare. Government is the one taking care of the Congress members. It's a government-sponsored healthcare. All you fighting for Medicare, it's a government-sponsored healthcare. Your military is government-sponsored. Your libraries, government-sponsored. We pay into it collectively, and the government runs it. But they tell you, you believe that the government is good at managing the military, but the government is going to be terrible at managing healthcare. That's the belief. You believe that the government can manage the airports, manage the roads, your infrastructure, but the only one thing the government is not going to be able to manage is your healthcare. And you support and enable a for-profit system that is bankrupting you. You are the victim, the direct victim, but you oppose the government touching your health care. Let make this make sense that it is not based on race. And I'm telling you, folks are going to rather suffer than accept that they pay into a system that they believe is going to benefit somebody else. And there's nothing further from the truth that a universal system is just going to just bring everybody in, illegals, folks that are not working. There has to be a system for everybody. But having insurance tied to a job that is not guaranteed is utter madness. Having insurance tied to an employer that can let you go at any moments given with reasons as simple as we are downsizing, we are relocating to China. Do you want to move to China with us? We are relocating to the Philippines. We're cutting the size of the company. Your department is downsizing. Those are some of the reasons of the layoffs. And now you have to worry about your mortgage. You have to worry about a lot of other things, but also you don't have insurance no more because that company let you go. And this is something that continuously people support as opposed to a universal care, a universal plan. I don't know what you call it. I don't want a plan that's tied to my job. A job I can lose at any time. And you can argue, okay, I shouldn't do anything to lose my job, but my job could also downsize. My job could also relocate. My job could also go out of business. Those are not factors that I contributed in. But a for-profit healthcare system cannot be good for anybody but those making the profits. Healthcare system is a scam. When you go to buy auto insurance, which is also in itself another scam, but not as bad as healthcare. When you go to buy auto insurance, let's use Oklahoma, which was my home for a very long time. They have hail damage, right? So you're going to have to buy hail damage insurance. It's not common for every other state that does not have hail, right? So you buy your Oklahoma State Farm insurance is unique because it has the component of hail damage to it. As long as you're using your insurance in Oklahoma, you're good. Assuming you decide to take a road trip and you decide to drive to the state of Maryland and you're going through Missouri, you're going through, I don't know, Missouri, I don't know, Illinois, you're going through a bunch of states, Ohio, Pennsylvania, West Virginia, and you eventually get to. You're going through all of the states. Say a police officer in Pennsylvania pulls you over and they're like, can I see your insurance card? And you present your insurance card from Oklahoma. They run it, it's valid. They say you have insurance. If you had an accident here, your insurance would cover it. Because there's no out of network, you're in network. With healthcare, they created this scam. out of network and in network. So if you go to the wrong hospital that's out of network, half the time they don't even want to take care of you. They're just going to manage you and send you back home because you're out of network. And if you're critical where they have to take care of you, your bill just doubled because you're out of network. So somebody's seriously sick and they're trying to figure out a way to get to the hospital. What is supposed to preoccupy them at that instant is the fact that they have to go to an in-network hospital, not their medical condition at the time. They have to be telling the ambulance people, please remember to take me to this hospital because it's an in-network hospital. And if you're unconscious and you don't know, and the emergency crew is just trying to take you to the nearest hospital, which could be out of network, your bill just doubled. So they bring you back to life and they double your bill because you went to an out of network hospital. And these are the geniuses that created a plan. Whoever came up with the concept of in network and out of network is the devil. It's the devil. If the devil was something real, if the devil was something that was humanly, physically, something you could touch, the person who came up with the in network and out of network for medical insurance is clearly the devil. So yes, by my estimation, the American healthcare system is a scam. It's a Ponzi scheme. A Ponzi scheme is a scam. The CEOs and the corporations, and these are the people making all the money, the for-profit hospitals. Did Obamacare fail? Obamacare failed. He had the ability to put a universal system in place and he decided to do whatever Obamacare is. But Republicans fought tooth and nail to ensure that we stay in a business healthcare environment. And they're going to tell you, listen, you can take 3-4 months to see a specialist in America. Don't think that to see a specialist is a phone call away. There are other people that want to see a specialist, just that one specialist. I've had appointments that are to see a specialist that are a month and a half away. So yes, and there's no willingness because of the 3,006 lobbies, 5.6 lobbies per Congress member to do any plan that is going to work for the American people. And these people are pushing marketing campaign to the very ignorant Americans, telling them that, yeah, communism is coming via medical insurance. And these are the people that are going to the hospitals and coming back with just visiting the ear and coming back with a $2,000 visit bill and ending up being bankrupt. Imagine that a developed country, not a shithole country, a developed country, has the most bankrupt people, not out from irresponsible financial dealings, but by just visiting a hospital, by being sick. The most humane activity of anybody, being sick. Americans are the sick of every Western country. The food is unhealthy. The processed apples are sprayed with all kinds of fruits and vegetables, sprayed with all kinds of pesticides. The goal is to make you sick so you stay a customer for a very expensive 5-star luxury hospital. It is a Ponzi scheme if you think about it that way. Talking about employer-based medical plan, and you get fired in a month. You get fired in a year. Your children, your wife, you are left now without insurance until you get another employer-based plan. How long are you going before you get another job? 3 months? 6 months? You run out your savings? A year? You start doing Uber to just pay bills while you get another job. You're doing something temporarily. But you didn't come to America for health insurance. You came to America to work. And work. Health insurance is a bonus. It's a luxury giveaway. You should thank the heavens that they even offer you health insurance in a plantation. You came here to work. And there's nothing else you should do than work and not complain. Who are you to complain? How dare you complain about a system that offered you the possibility to work and you're complaining about health care? If you like Canada so much, go to Canada. If you like the European medical system, go to Europe. In America, you are here to work. And any insurance we give you, you are going to accept it as the default insurance, and you're going to pray and thank God that you have something that you can even go. How are our hospitals supposed to make money? It's a profit system. It's not a charity system. We're not here to do good for humanity. We're here to make money. You either work or you make money. And if you're not making money, you have to work. So if you get fired or if you lose your job, hurry up and get another job. But you must be employed because you got to pay your taxes. If you don't pay your taxes, Uncle Sam is going to come after you. But is the American medical system a scam? Yes, and everybody that partakes in it is a culprit. It's an accomplice. Pharmacists, doctors. I'm sure they're good pharmacists. I'm sure they're good doctors. I'm sure they're good people in this broken system. But unfortunately, we're going to cast everybody. And that's the sad thing to do, because there are people that are fighting against the system, because there are hospitals that are not-for-profit hospitals that get lost in translation because the greedy for-profit. And you should know before you go to a hospital, say, is this a for-profit hospital? Yes, they probably have all the best equipment, but understand that you are not a priority. You are a number. It's your host for the Village Boy podcast. Continue to support our channel as we have this very different perspective in conversations in the space. Thank you.